Give me a big breath.
Doctors diagnosed 31-year-old Jessie Meador with diabetes when she was a baby.
My mom went to wake me up from a nap, and I wouldn't wake up.
She was 13 months old, and no one was sure she would survive.
And I was in the hospital for close to a month. I was in a coma for 4 days.
The Rockingham County mom of 2 has lived with type 1 diabetes all of her life.
Swallow for me.
I'm here, and I get to help make a difference.
Meador's mission to help others starts inside Annie Penn Hospital in Reedsville.
We will start in January, really recruiting.
She's a volunteer with the Diabetes Task Force of Rockingham County.
Since I had such a passion and a connection to diabetes, it just made sense for me to join in on that task force.
Created in 2012, the task force helps people who are struggling to manage their diabetes, creates access to treatment, and educates the community on ways to prevent the disease.
It is a crisis, it's a pandemic.
Dr. Jessie Meador is also on the task force.
It's not the problem of Rockingham County, it's not a problem of North Carolina. The diabetes trend is growing everywhere.
Dr. Meador is the only cone health endocrinologist in the county and treats hundreds of patients a month at this diabetes management center in Reedsville.
Because this is an area which is very heavily affected by diabetes, not only in Rockingham County. The 5 surrounding counties to Rockingham County have average adult population of 12% with diagnosed diabetes.
Type 1 diabetes is very rare, impacting about 5% of diabetics. Like Meador, people are born with type 1, so there's no way to prevent it. Type 2 diabetes, however, is largely preventable with diet and exercise.
We have to eat less, and we have to move more.
People who are overweight, have a body mass index over 25, and have high cholesterol should get screened with a blood test. Left untreated, diabetes causes serious complications, including heart disease, stroke, kidney failure, and even blindness. Meador says it's not worth the risk.
If you can avoid it, avoid it. I couldn't avoid it. There was no choice. I had no say in this. If I could be without it, I would be without it. So do whatever you have to do, and it's really pretty easy. You need to eat well and exercise, drink water. Those 3 things will save your life.